So welcome everyone to this community chats of today. Today we're going to be talking about cardiac arrest. And I know that a lot of people are interested in knowing how they can save a life or maybe they can save themselves. So of course we have an expert today, Dr. Ari Moskowitz, who's going to be talking to us about this. But not only that, I mean, just a reminder that this is an open forum and we want to hear from you. So if you're an attendee, please start asking questions, letting us know your thoughts. Any way that you want to interact with us, you can use the chat, you can use the Q&A. Whichever way, I'm going to be very happy to read all your questions, comments, and thoughts to Dr. Moskowitz. And that way, we're going to keep it interactive. And he has a presentation for us today. But first of all, Dr. Moskowitz, thank you so much for being with us today. It's great having you. It's a pleasure and a great benefit to have, you sharing your knowledge with us.
Of course, and thank you, Sandra, and thanks for having me. My name is Dr. Ari Moskowitz. I'm an intensive care doctor at Montefiore, and I'm the ICU director, so the intensive care unit director at Montefiore Medical Center. And I'm very excited to be talking to you all today about cardiac arrest. Cardiac arrest is what I do all my research in. It's very near and dear to my heart. I think it's an incredibly important and under-recognized thing that we all encounter in our lives. So excited to talk to you today about it. And as Sandra said, from my standpoint, this is informal. So please ask questions, jump in at any time, and happy to answer any questions.
Excellent. And so that we have a lot of students here, and they're also interested on the topic. So we're probably going to get very good questions today from them.
That's great. Keep them coming. It's keep them coming. I love that. So I think the first question that I always get asked is, what is a cardiac arrest? And I get asked that question because it often gets confused with a heart attack. And can you see my screen okay? Sandra, is it coming through? Sandra, is the screen coming through okay?
Yes, it is very good.
Okay, good. So, I think often the concept of cardiac arrest gets confused with a heart attack. And while a heart attack can lead to a cardiac arrest, they're very different things. And I want to demystify that a little bit. So a cardiac is really when the heart malfunctions entirely and stops beating. So there's no more heartbeat. When that happens and there's no more heartbeat, there's no more blood flowing to the brain or other vital organs. And really there's seconds before you start to see brain cells and other cells dying. So it's a real emergency. It's really important very early on, and we'll talk about this, to start therapy even before trained professionals get there. So even before EMS arrives or a doctor arrives, to start doing what you can to resuscitate the person. And we'll talk more about that. A heart attack is a little bit different. A heart attack is when there's a blockage in one of the blood vessels that supplies blood to the heart. Now, blockage in one of those blood vessels can certainly lead to a cardiac arrest. It can lead to the point where the heart stops beating entirely, but it doesn't always. And in fact, most of the time it doesn't. A heart attack is definitely an emergency, and it's something that needs to be cared for in an emergency department right away, but it's not the same as a cardiac arrest, which really needs immediate therapy for the patient. Now, cardiac arrests, we see them on TV or in the movies happening, in hospitals, but really cardiac arrests can happen anywhere. They can happen at home or in your apartment. They can happen in public at supermarkets or other public stores or areas. They commonly happen within the hospital, in the gym. So they can really happen everywhere. And that's why it's so important to understand what a cardiac arrest is and what you can do to respond. And it really is a major public health concern. And I think it's really not recognized by the public at large how important cardiac arrest is. This slide here, you can see a bunch of different disorders. Ischemic heart disease, which is what leads to a heart attack, as I mentioned earlier, a blockage in the blood supply to the heart, lower back and neck pain, drug use disorders, lung cancer, COPD. And you can see where cardiac arrest falls in terms of how much of a quality of life you lose. And cardiac arrest is really the third leading cause of lost quality of life years in the United States. So it's a really important thing, and something that really contributes to a lot of disability, a lot of early death, but doesn't often get the same sort of publicity as some of these other conditions do. But it's important that we recognize it and we know what to do. The American Heart Association really leads the way in the United States, at least, in how we respond to cardiac arrests. And they've put together the what we call the links of survival. And there's 6 links for survival as a cardiac arrest. And many of these, if you're a layperson or if you're even if without any medical training, can really help be a part of. So what you can see here is in blue, this lay rescuer, or just someone that doesn't have much medical training. They can call 911, and we'll talk about that in a second. They can start CPR, chest compressions. They can use an automated defibrillator device. And then you get to the professional responders, the EMS response and the hospital care. And we'll talk a bit at the end about recovery. But it's really important to recognize that you really need all 6 links of the chain of survival to have good outcomes after cardiac arrest. It's really, really crucial. Now, starting with that first link in the chain, getting the emergency services activated. So early intervention is key. And what we often say is that if you see or you suspect that somebody had a cardiac arrest, the most important thing to do is to assign someone to call 911. And if no one's available, call 911 yourself before doing anything else and get emergency services on the way. Because really getting the emergency services there is probably the most important thing that you can do. One of the most common errors that we see is patients who can appear to be breathing, but really have no heartbeat. It often looks what we call agonal breathing, that they're struggling to breathe, but it's really important that if somebody is down, they're not responding, that you go and you check their pulse and see if there's a pulse there. Because if there's no pulse, that was just that they're in cardiac arrest, even if you do see them having some breathing going on. Now, the next key piece in the chain of survival is starting chest compressions. So chest compressions are where you push on the patient's chest to help simulate a heartbeat and to help push blood around the body. What you can see here is what happens if you do or you do not provide CPR to a patient. So you can see that on average, there's about 10% survival with cardiac arrest. But if you get CPR from a bystander, if somebody who's not, even an EMS or a doctor or a nurse does CPR, that can get up to 30%. And if you do CPR, you use a defibrillator device, which we'll talk about in a second, that can get to as high as 50%. And it really shows how important it is to be trained and ready to do CPR in the event of cardiac arrest. And it's really, really crucial. In fact, it's so crucial that the American Heart Association has changed how we approach someone in cardiac arrest. So you may, have been taught in the past or seen on TV that the first thing that you do is you do mouth-to-mouth breathing with the ABCs of cardiac arrest. And that's really gone away. And what we do now is this CAB approach, and we start compressions first to make sure that because we think that's the most important element of getting someone back from cardiac arrest, those chest compressions. The airway and the breathing come second, but really, if you do nothing else, just doing chest compressions is really key. And I think that's important because a lot of times people don't feel okay or feel comfortable doing mouth-to-mouth, especially with a stranger, especially in the age of COVID. But even if you just do chest compressions and don't worry about the breathing, that can have a huge impact on someone's survival. When you do chest compressions, it is important that you're trained to do them, and we'll talk about that at the end. But doing high quality chest compressions is key. You want to make sure that chest compressions are going on for at least 80% of the time that the cardiac arrest is going. Try to minimize pauses as much as possible in chest compressions. Try to go fast. People say to sing a song in your head like Staying Alive or something like that, to try to get a compression rate of 100 beats per minute. Making sure that you're pushing hard as well. Getting at least 2 inches down when you're doing your chest compression. So pushing hard and fast is really key. And again, really not worrying too much about the ventilation aspect of it. It's really the chest compressions that I think are the most important. I want to point this out because I think it's a really important article that just came out recently in the New England Journal of Medicine. The New England Journal of Medicine is, as many of you probably know, the premier medical journal for research worldwide, or one of the premier medical journals for research worldwide. And they published this article looking at how often patients are getting bystander CPR for cardiac arrest, both at home and the community. And they looked to see comparing white patients to Black or Hispanic patients. And you can see here the years on the x-axis, 2013 to 2019, and the percentage of cardiac arrest getting CPR from 0 to 100% on the y-axis. And over every year, and without much change, you can see that Black or Hispanic patients are less likely to get CPR at home. and are also less likely to get CPR when they have a cardiac arrest in public. And as I showed you earlier, getting early CPR is probably the most important thing that you can have when someone has a cardiac arrest. And understanding this disparity as to why Black and Hispanic patients are not getting as much CPR, both at home and at public, is really crucial. There's probably a lot that goes into it, and a lot of things that we can modify, things like getting more CPR training for Black and Hispanic people and in the neighborhoods, making sure that Black and Hispanic neighborhoods have easy access to AEDs, things like that. But I think there's a lot more work that we need to do on this disparities front. So let's talk about AEDs. I mentioned that a few times. So AEDs are automated external defibrillator devices. What they do is they can provide shocks to patients who are in certain cardiac rhythms with cardiac arrest. Your heart naturally has its own electrical pacemaker, so it has its own way to send electricity and to generate heartbeats. When that gets abnormal, that's when you can have a cardiac arrest. And the defibrillator can shock it and basically reset the heart to get back to a normal heartbeat. It's not for every arrest. So what you can see here is this is normal sinus rhythm on the top. This is what your heart rate should look like. There's certain key waves here. So this is what's called the P wave right here. This is the Q wave, if there is one, and then the R and S wave and T wave. So there's certain waves that you should always see in every heartbeat. What can happen though is that with your heart can go into very disorganized and chaotic rhythms. This one called here ventricular fibrillation. And with such a disorganized rhythm, your heart more quivers than beats and does not adequately provide blood to the rest of your body. This is the sort of rhythm where you would need to deliver an electrical shock to reset the heart to the normal sinus rhythm that you see up here. And doing it quickly is really, really crucial. Now, AEDs can be found pretty much everywhere. And I hope that after this talk, the next time you're in a public place, whether it's school or it's a airport, that you keep an eye out for where the AEDs are, because I think it's really important to know where they are, to also identify areas where you can use an AED. A gym, for example, should always have an AED in it. Increasingly, we're getting better and better at getting AEDs to where they need to go. On the right side here, actually in a lot of rural areas, they are now doing drone delivery of AEDs, where you can have an app where you push a button and a drone will fly an AED to your location within minutes. Many other countries, and it's going to be coming soon to the United States, I believe, also have apps that show you every AED in the area, so you know where to run to in the event of a cardiac arrest to find the nearest AED. Really crucial elements. So what I thought I'd do, and see if this works here, is show you guys a bit how an AED works. Let's see if I can get this to go here. Let's see here. Can I get this to work? I think it's going to go in a second.
Yeah, I think it's loading.
Yeah.
Sudden cardiac arrest. He's unconscious. Go to the front desk, call 911 and bring me the aid in. Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use. An AED, or automated external defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the factor to the AED if necessary. The AED should start analyzing the person's heart rhythm. Analyzing heart rhythm. Do not touch patient. Analyzing. Do not allow yourself or anyone else to touch the person while the AED is analyzing. Shock. Move away from the patient. Make sure that no one, including you, is touching the person. Red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person. Do not touch patient. Analyzing heart rhythm. Continue to follow the prompts of the AED and provide care as needed. It is now safe to touch the patient. Start CPR. If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition.
So that's a little bit about the use of AEDs. Again, there's a lot more training that can be done for these AEDs. Pause it again here. But I think it's really important to sort of know their use and to be comfortable with their use. Now, after a patient achieves return of spontaneous circulation, meaning that they are resuscitated from cardiac arrest, they now have a heartbeat and a blood pressure, they're going to be transported to the hospital. A lot of patients after cardiac arrest, even after they get blood flowing again, still need a lot of support. That period of time where they had no or low blood flow to their various key organs can really affect those organs and lead to organ failure. And many patients do require things here, such as mechanical ventilation, kidney replacement like dialysis, and blood pressure support, very common after cardiac arrest. And many patients will be in the intensive care unit for a considerable period of time. It's also very important to understand how the patient's brain does after cardiac arrest. Because they have a period of time with no blood flow to the brain, often there's some degree of brain injury, and it can be very hard to know when a patient will wake up. Sometimes that's within hours, sometimes it's within days, sometimes it's within weeks, but there's not great ways, and we haven't really quite figured out a way to know exactly who's going to wake up and who will remain comatose and not following commands after cardiac arrest. We do know that waiting a little bit longer and not giving up too early is important, because some patients do wake up late after cardiac arrest, and giving them people time to wake up and to wash out all the drugs and everything that they got during the CPR can be very helpful. So moving along, we've gone through calling 911, doing CPR, using the AEDs, the EMS response and hospital care, and I'm talking a bit about recovery. So many patients who have cardiac arrest, or really any ICU stay, can often suffer from this post-intensive care syndrome. It's very common. Any of you who have family or friends, or if you yourself have been in the ICU, you may be familiar with this. Many patients have physical impairment, muscular weakness, fatigue, and difficulty breathing after being in the ICU for some time. There's often post-traumatic stress disorder with anxiety and depression after being in the ICU. And very importantly, and probably perhaps most prominently, is cognitive impairment, memory difficulties, difficulty with attention, that feeling of brain fog. Very, very common, and something that's very important to seek help for as soon as possible. And also, something that's very related to cardiac arrest. So how can you prepare? I think the best thing to do is to find a CPR course. As you can see here, looking at sort of the New York tri-state area, there's hundreds of courses going on all the time to learn how to do CPR, to get trained in basic life support. I think it's very empowering, and I think it comes up more than you think it's going to. So highly recommend that you go to the AHA website and push find a class, and try to get into a class to learn how to do CPR, use the AEDs. Very, very crucial. Montefiore itself also offers free CPR training. You can email this number here or call cprtraining@montefiore.org. And there's a number of classes that by Montefiore at all the different sites, which again, I would highly recommend you look into. And then finally, advocacy. So things like asking for CPR training in schools. In European schools, for example, it's mandatory in many countries that everyone gets CPR trained. As I mentioned, checking your local areas for AEDs and making sure that they're available, teaching community members the signs and symptoms of cardiac arrest, and to have a plan for if a cardiac arrest were to happen. So in summary, cardiac arrest is common and a major public health problem. It's different than a heart attack, and while both are emergencies, the response to cardiac arrest has to be immediate with at least the start of chest compressions. And you can help by learning CPR, by advocating for more AEDs, and by encouraging basic life support training in your communities. So that's what I have, and I'm happy to take any questions.
Thank you so much for that presentation and for the video. It really gives us an idea of how to do the AED and all of that. And yes, I do have a couple of questions while we get the questions from our attendees. Well, I think you answered this already, but if you haven't had any training to do CPR, can you still do CPR or you should stay away?
That's a great question. And I think something that we often see patients who suffer cardiac arrest who don't get CPR. And when we talk to family members, they say, well, I never was trained. And as I mentioned, the most important thing is to be trained to do it. But the second most important thing is, even if you're not trained, it's very simple to do. And some CPR, even if not perfect, is better than no CPR. So I'd say, even if you're not trained, and you think someone's in cardiac arrest, I would start CPR right away to the best of your ability. Before, and even that imperfect CPR is better than no CPR for sure.
Mm-hmm. Now, I remember years ago when I was doing a CPR training, I asked my trainer, like, can I kill somebody by doing the wrong CPR? Because I think, at least for me, and I know a lot of people might share the same concern, is like, you don't want to be part of someone's dying or death, right? So, and then if I remember correctly, the answer that the trainer gave me was like, well, pretty much when you're in cardiac arrest, you're already dead. So you're only helping them to survive. But so always something is stuck in my head being like, wait, what? So what do you think of that?
It's definitely scary, right? I mean, these situations, while we talk about them here and it's all very calm and on Zoom, when you get into these situations, it's very scary and you don't want to do the wrong thing. But like you said, these patients, if they don't get some CPR by somebody immediately, their chances of survival are much lower. So while it's definitely scary, you can't do any harm to the patient by doing some CPR. Now, obviously, if somebody who's trained comes along and wants to start doing CPR, that person should do it. But in the absence, if you're by yourself and there's no one else around, then the first thing you should do is call 911 and then immediately start doing the best CPR that you can. You're not going to hurt the patient.
Mm-hmm. Do you have any tips for people who are not CPR trained on how to start doing this and to feel a little bit more confident?
Yeah, for the first thing I'll say is get trained. There's, as I mentioned, there's so many different resources to do training. I know it can be time consuming, but get a group of friends together on a weekend or in an evening and just do a CPR training class. I think you'll feel so much more confident. And you'll learn a lot too. Everyone that I take through these training classes, I think really appreciates it at the end. If you're not CPR trained, I think the most important thing, as I mentioned, is pushing hard and fast. So trying to sing a song in your head that has the right beats, the right cadence. So we always say "Staying Alive" is the song. Staying Alive. That song, it really has that right beat to it. So trying to sing that in your head, so you have the right beat down, and pushing hard and fast. So really trying to push hard and quickly is the most important thing.
Mm-hmm. When we're doing CPR, does this break the sternum or any of the ribs? Because you have to go deep enough. So
it is possible. Unlikely to break the sternum, but it is possible to break some ribs. That can happen, but that's fixable. I think what's not fixable is a long time without blood flow to the brain. So even if you break some ribs, and again, it's easy to sit here and talk about this on the Zoom, and it's scary in real life for sure. But even if you're breaking ribs, it's more important to get the blood flowing, because what really ends up killing people is that period of lack of blood flow to the brain.
Mm-hmm. Okay. Who can have a CPR? Not a CPR, an AED. Is it possible to have it at home? Do they have some of them that are for homes as opposed to institutions?
They do some very high risk patients do have them at home, but in general, they're sort of in public places and institutions, and EMS will always bring them when they're called. it's it's an uncommon event, and so it's uncommon to have them in the home. But they should be in every apartment building should have an AED in the lobby or something like that. So there should always be one that's accessible.
Mhm. And we have a question here. How effective is the Trendelenburg position during the patient's recovery phase or in the ICU stay as it pertains to hypotensive problems?
Yeah, the Trendelenburg position for someone that's very hypotensive can be beneficial in the short term. So immediately after someone becomes hypotensive, putting them in the Trendelenburg position, which means putting their head down and their feet up, can help perfuse. But really, it's a temporary measure. Your brain very quickly adjusts to that, and the blood flow doesn't go up anymore. And it's more important to get the patients, what they need, and whether that's more fluids or whether that's, blood pressure support with vasopressors. Those are the more important things to do. Being in the Trendelenburg position also, during and after cardiac arrest has some negative consequences too. One of which is that it makes what's called aspiration more likely. So people who have full stomachs can vomit, and that can go into the lungs. So you have to be a little bit careful about that. And also puts more pressure on the brain. So we don't typically do Trendelenburg position for long periods of time after cardiac arrest.
Mhm. I understand that the CPR that you need to do for an adult is different than for a child, especially an infant. Can you talk about that a little?
Yeah, so as part of BLS training, so if you do one of these classes, you'll be trained in both infant and child CPR and adult CPR. There are some similarities, and it depends on the age of the child, but there's a lot of differences as well. Often with child and infants, the most common issue is choking. So learning how to deal with the choking infant or child is probably the most important thing. Learning how to clear that airway and focusing on that element is much more highlighted in the infant and child CPR classes. So they are a little bit different, but if you do a BLS class, you'll definitely cover that. That piece too.
Those classes at Montefiore, do they have any cost?
I don't believe so. Don't quote me on this, but I think for employees at least, they don't have any costs. I don't know for sure about others, but definitely something to look into, but I don't know for sure.
And do you know if they are on Zoom or in person, or they always have to be in person?
All in person, yeah. All these classes are in person because they're generally done with CPR dummies, and there's a lot of hands-on components to it.
Another question that I see here: what if the person has a pacemaker? Does that make any difference?
So from the perspective of somebody that is doing CPR, outside the hospital, so in a public place or at home, it shouldn't make any difference. If they have a cardiac arrest and there's no pulse, you would treat them the exact same way. So from in the hospital, when we're really looking at someone's heart rhythm on a monitor, we might do things a little bit differently. But from the standpoint of a lay rescuer, someone at home or in the public place, it wouldn't worry anything about that. And in fact, wouldn't worry really about any of the other comorbidities or other medical problems the patient has. It's all very algorithm based, and you just follow the algorithm and try to get that early CPR going.
And one more question: as of recent times due to COVID, I've been informed that giving mouth-to-mouth breaths during CPR might not be recommended. So do you agree? And I think you answered this in your presentation, but do you agree? And is it pertinent to give breaths, or would compressions be enough to ensure survival?
Yeah, so it's a great question. So during the pandemic, the American Heart Association updated guidelines to de-emphasize the use of mouth-to-mouth in the COVID era, just because of the risk, and this is true for all CPR. So we always say in the trainings that the first element of CPR is to make sure that the scene is safe and that you're safe. So just like I would be careful that, mouth-to-mouth in the setting of a respiratory pandemic, you want to be careful if someone is lying in a pool of water and there's electrical cables nearby you. The most important thing is to protect yourself as the rescuer, and to make sure that the scene is safe and that you're safe. In general, and to this question, the increasing thinking is that what's most important is the chest compressions. So if at all you feel uncomfortable, just focusing on chest compressions or what we call hands-only CPR is very effective, and we think will increase the use of CPR because people don't have to worry about doing the mouth-to-mouth and any concerns there. So if there are concerns, if there's a lot of COVID going around at the time, just do hands-only CPR, just chest compressions, is recommended.
Mhm. Could any of the warning signs for a cardiac arrest be confused with something else that we shouldn't jump in to do CPR in order
Yeah,
to?
the most important thing is just to feel for a pulse. So if you see someone and they're not conscious, you should check for a pulse and see if there's a pulse. If there's no pulse, then you should just do CPR and not worry about any other conditions or things like that.
Okay. Should even an elderly person, age 80, attempt CPR on another person?
I think again, it all comes back to safety. So I know a lot of 80-year-olds who probably are stronger than I am. So I think it depends on the person and how safe it is for them. If they feel like they can do CPR, again, it's better than nothing. Even bad CPR is better than no CPR, because really the key is to try to get that blood flowing as even a little bit. So if anyone can do it and they feel comfortable doing it, they should just jump in, even if they're a little on the older side.
Mhm. Okay, I don't see any more questions coming. I don't know if you have any further comments or any last thoughts, Dr. Moskowitz.
No, I think if people are interested, they have questions, feel free to share my email. I think cardiac arrest is something that I'm very passionate about, and would love to see more people trained, especially in I think the communities that we tend to serve are those where there's not as much CPR training going on, and as I showed in the presentation, the use of CPR and chest compressions is lower in some of the communities that we serve. So really trying to emphasize uptake CPR training is just really key, and would emphasize that.
Well, thank you so much, because I'm CPR trained, and however, I always think, oh my God, if the day comes, I don't know if I will be able to do it, with the stress of the moment and all of that, but you certainly have given me confidence that I can do it. Even if I don't do it exactly the way the trainer told me, I feel like now I'm ready to save a life. So thank you so much for that. It's changed my life now, and hopefully save somebody's life. So thank you so much for that. And thank you for answering all of our questions. And we hope to see you more often. And if not you, definitely somebody from your team, because we're going to be in touch. So thank you so much. And for the link to the recording, I'm going to be sending that to Dr. Moskowitz and all of you in attendance today. And see you next week, I guess, on Thursday at 12. And what's the topic for next week? Actually, nutrition, like what are the best foods to prevent cancer. So if you want to learn more about that, join us next week. Thank you so much, everyone. Bye.
Thanks, guys. Bye.